Info for patient.
This is to become a female urology. There are two main factors. First of all, you have to like it. So you have to want to be urologist, and you have to be willing, because this is a surgical specialty, medical surgical. So you have to be willing to sacrifice hours, family, other social activities, because the life of a surgeon in general is not a path of roses, you know. It's heavy, I can tell you. And this is, first of all, willingness. So you have to want it, and you have to want it very much, very much. And second is opportunities. And here I'm talking not only about equality, but about equity. Equity is one of the objectives of the World Health Organization and of the United Nations, but to reach equity is a difficult concept. It's not only what you want, not only what the ones who are around you want. Is a societal problem. So you need to be in a definite environment. But things are changing, but there are still differences, cultural and social differences between the East and the West, and it is not something that you get in 1 year. It takes 1 or 2 generations to get this. So, but it requires an effort of all of us, males, females, up, down, whatever it is, to reach this. There is a trend, and I think that we are in the way to get this, and that will be something nice. But it's gonna be more difficult in developing countries than in the developed countries, or it's gonna take, or has been appearing late. So give time, and it will come. And take into account that in cultural and societal movements, you need what is called the critical mass. So the critical mass is between 15 and 25%. At the moment that a group reaches this prevalence or this incidence in the society, starts to be, others start to come and starts to be in the scenario. So with 11, 10%, 14% of women in urology, we are talking about urology right now, we are near to reach in the West, which is called critical mass. Here in the East, it's gonna take at least 10 more years. That's just an estimation.
How do you see robotic surgery in future?
Well, this is the best toy that we have been having in the last 40 years, and whether it is a benefit for the patients or not, there is a lot of discussion, but there is clear that is a benefit for the surgeon in ergonomics and in facility, and everything which is good for a surgeon may not be, should not be bad for a patient. So I think that with this you have the definition of what I think about robotics. Yes, robotics are here and are going to bridge the time, or to bridge the surgery, the gap between the conventional surgery, minimal invasive surgery by laparoscopy is very difficult, and I know because I've been doing it for 20 years, so I know my back, but the robot is gonna, in a way, is gonna bridge this gap between the open or laparoscopy and nano surgery. But nanosurgery means that at the end you will not need to do surgery, but you will just get a pill or just put a chip there, which is going to target this cancer. But for this still, we need 1 more generation of physicians to reach this stage.